These are the instructions for the placement of the PENS electrodes when using electrical stimulation for the treatment of dysphagia. The first thing we do is we prep the skin with water. The reason being is that water is a good conductor of electrical current. This is unlike the surface EMG sensor electrodes. In those electrode packages you'll have a prep pack, but those prep packs include alcohol, which can dry out the skin. So again, when you're applying the PENS electrodes, all you need to do is use water. The first thing we'll do is have the patient go ahead and clench their teeth, bite down, so you can palpate the masseter. This is the target area for the PENS electrode. So I'll go ahead and bathe the skin. You can use a fair amount of force, again, just trying to clean the skin a little bit. Once that's done, I can take the electrode, and when you're orienting the electrodes, you have electrodes that have a green backing and also a blue backing. So we'll put the same color electrodes on one side, so in this case I'll put the green electrodes on the right and the blue electrodes on the left. The other electrode placement is the posterior cervical spine just below the occiput, so I'll prep that skin as well, again just using water. And for the placement, again I can have the patient lightly clench their teeth, palpate the masseter, and place the electrode along the path of the alignment of the fibers of the masseter, just like so. And for the posterior placement, I'll go ahead and place the electrode, which again just below the occiput and just immediately right to the midline, or just to the right of the spinous processes. So just like so. And then, as I mentioned, we will go ahead and repeat the placement of the electrodes, the blue pair of electrodes, on the left side of the patient's body. So that is the PENS electrode placement setup.